The way to understand, I think, Indian hospitals is to recognize that they were established and operated in the interests of non-Indigenous people.
As Canada finally begins to reckon with the brutal legacy of the Indian residential school system, a light is now being shone on the Indian hospital system, a system developed with the promise of providing health care in the face of rising tuberculosis rates that instead delivered segregation, isolation, and pain.
Indian hospitals initially were rationalized as institutions to treat tuberculosis, but they operated as general hospitals. So there was maternity wards, there were pediatric wards, there were medicine wards, and tuberculosis in the same institution.
Maureen Lux has researched and published extensively on Canada's Indian hospitals. Lux says they emerged around the turn of the century, but the end of the Second World War and promises of more health care led to expansion.
The federal government had redundant military facilities, and so many of these were put to a new use, and that was as the so-called Indian hospitals.
At one point, Canada had 29 Indian hospitals, many near major cities, though segregated from the community. Charles Camsell Indian Hospital sat in Edmonton, while Mountain Sanatorium operated in Hamilton, Ontario. Many patients were not there of their own volition, hospitalized under public health orders.
The Indian health regulations said that Indigenous people who were ill must see a physician. If the physician recommended hospitalization, that person must report to a hospital, and that person must remain in hospital until discharged. So the patient could not leave against medical advice.
By the time they might have been released from the sanatorium 2, 3, 4 years later, they no longer had contact or knew the whereabouts of their children, and the same with parents and siblings. So that was a devastating impact of these forced separations.
Veldon Coburn is from Pikwakanagan First Nation. He says, like many, he only learned about Indian hospitals later in life. Lux says this may have been the point.
One of the rationales for Indian hospitals was to isolate and segregate Indigenous people from settler institutions. And I think that the kind of ignorance about Indian hospitals today may be a function of this success.
The last Indian hospital closed in 1981, but Lux and Coburn say the legacy of these hospitals is present in every Brian Sinclair or Joyce Echequan subjected to second-class treatment in our hospitals.
The notion that Indigenous people are not worthy of first-class care I think is very much a legacy of this 20th century healthcare of history.
In Ottawa, Xiaoli Li, City News.